nutrients, yet these interactions can affect both medication effectiveness and your nutritional status. Understanding these relationships helps you optimize both medication benefits and nutritional support during illness. Acetaminophen, known as paracetamol outside the US, is the most common fever reducer. What many don't know is that repeated use depletes glutathione, your body's master antioxidant. Glutathione is essential for detoxification and immune function. While occasional acetaminophen use isn't concerning, taking it every 4 to 6 hours for days depletes glutathione stores. Counter this by ensuring adequate intake of glutathione precursors, the amino acid cysteine from eggs and chicken, and vitamin C, which supports glutathione regeneration. NSAIDs like ibuprofen and naproxen can irritate the stomach lining. Taking them on an empty stomach increases this risk significantly, potentially causing gastritis or ulcers with repeated use. However, food slightly reduces peak drug levels, meaning pain and fever relief might be marginally less effective. The trade-off usually favors taking NSAIDs with food or milk to protect your stomach. Long-term NSAID use can deplete folate, though this is more concern with chronic use than a week of flu treatment. Decongestants containing pseudoephedrine can interact with tyramine-containing foods, though this is primarily concerning at high doses. More relevant is that decongestants can suppress appetite and cause dry mouth, compounding the existing appetite and hydration challenges of flu. Cough medications deserve attention. Dextromethorphan, a common cough suppressant, is metabolized by liver enzymes that grapefruit juice inhibits. Drinking grapefruit juice while taking dextromethorphan can increase drug levels unpredictably. This is rarely dangerous, but can cause increased side effects like dizziness. Codeine-containing cough medications interact with certain foods and other medications in complex ways. Liquid medications, especially pediatric formulations, are often loaded with sugar to improve palatability. As we discussed earlier, high sugar intake impairs immune function. You're taking medicine to feel better while potentially prolonging illness through sugar's immune effects. Unfortunately, there's often no sugar-free option, so this becomes a calculated trade-off. If you develop secondary bacterial infection requiring antibiotics, interactions become more complex. Fluoroquinolone antibiotics bind to calcium, magnesium, and iron, significantly reducing absorption. Take these antibiotics at least 2 hours before or 6 hours after dairy products, antacids, or mineral supplements. Tetracyclines have similar interactions. Probiotics become essential during antibiotic therapy, but should be taken 2 to 3 hours apart from antibiotic doses. Alcohol deserves special mention. Many traditional remedies include alcohol, hot toddies, brandy, and tea, but alcohol interferes with immune function, worsens dehydration, and interacts dangerously with acetaminophen and other medications. The combination of acetaminophen and alcohol can cause severe liver damage. Even without acetaminophen, alcohol impairs the immune response you're trying to support. Timing strategies help manage these interactions. Take acetaminophen with food to reduce nausea while ensuring diet includes glutathione precursors. Take NSAIDs with food or milk. Separate antibiotics from dairy and mineral supplements by 2 hours. Take probiotics away from antibiotics. Avoid alcohol entirely during illness and medication use. Your pharmacist is an underutilized resource for identifying these interactions. When picking up medications, ask specifically about food interactions, timing with meals, and any nutrient depletion concerns. Pharmacists have extensive training in drug-nutrient interactions that most doctors don't emphasize during brief sick visits. The broader point is that medications and nutrition interact constantly. Neither works in isolation. Optimizing both requires understanding how they affect each other and adjusting accordingly.